Well, good morning, everyone. It's great to see you. And I really emphasize that it is really great to see you. After experiencing detached retinas in each eye due to stage 4 diabetic retinopathy, I am fortunate to see anyone this morning. So thank you for your efforts. That all had something to do with it. So a quick show of hands. Who here is a type 1 or has a loved one with type 1? So you can all appreciate why we're here and also share my fear of complications. So in 2017, I went in for my annual eye exam. This is just a precautionary, annual check-in that every type 1 should do just out of habit. I had no symptoms, no reason for concern. After my dilated exam, I was shocked when I was called back into the room and was told that the doctor had discovered that I had swelling in my blood vessels in my left eye. Despite my best efforts, here I was facing a complication already at the age of 31. So it was a shock to me and my family. 2 days later, I was taking my first Eylea eye injection. A month after that, I was in for scattershot laser therapy to try to zap those pesky, chaotic blood vessels that started to sprung up. And then one day I woke up and I noticed the top of my field of vision was blurry and cloudy. Called the surgeon right away. And 2 days later, I was in for eye surgery. They drained the vitreous fluid. They zapped the lasers. They reattached my retina. And for the time being, I had staved off disaster, but it was a pretty scary experience and something that I still have nightmares about to this day. So I thought I was out of the woods, something that maybe I'll have to deal with in decades to come. But 2 years later, I woke up with blurred vision in my right eye. And I had to face an unknown outcome all over again. End result was another detached retina. Again, fortunate to have the great care of my doctors and that team. And it was a good outcome for me. Unfortunately, it's not the same for everyone. I have a close friend that my family has known through JDRF who went through the experience just a few years before I did. To this day, it's limited his career. He doesn't have a license and he still deals with double vision and blurred vision. So it's something that he's had to live with. And I'm fortunate I went through the experience when I did. Had I went through it just 10 years earlier, I shudder to think of what that outcome might have looked like. So I had faced a very real possibility of vision loss. As it was, I came through it for the time being, but I never know what the future is going to hold. At times, type 1 diabetes can cause an even greater emotional toll than it does a physical manifestation. To this day, I constantly worry. Sometimes I'm overwhelmed about the potential for reoccurrence, the potential consequences that would have on my quality of life, my independence, my career, and someday seeing my kids achieve milestones in their lives. I feel fortunate, but I'm also it's always in the back of my mind. I have an opportunity to meet a lot of families with young kids who have been diagnosed with type 1 diabetes. I'm asked for words of advice or for some encouragement. I'll always tell them that with technology, with such as closed loop systems, good carb counting skills, proper diet and exercise, they'll live a pretty normal life. Their son and daughter can live a pretty normal life. Sometimes I'll share that the constant battle to maintain type 1 diabetes will create a mental fortitude that will benefit them in everything they do. The unfortunate reality is as resilient as we are and as our bodies can be, diabetes is a terrible and unrelenting disease. Diabetics such as myself are all at risk of complications. And I believe the most recent statistics show that 35% of type 1 diabetics will develop diabetes-related eye disease at some point in their lives. My fellow diabetics and I are completely reliant on your hard work and your research that you are also passionate about. I sincerely appreciate your efforts and for Dr. Levine for starting this initiative. Thank you. Well, I want to thank you for the progress that has been made. There is a lot of work yet to be done. I ask you to help achieve earlier diagnosis, more effective early stage treatment, and the recovery of lost vision. I say that not just for selfish reasons, but so that my friend Tommy and others like him can regain their independence. And so that when we meet a newly diagnosed child, we can look them in the eye and tell them that they have a bright future. Thank you.